Okay, welcome. So good morning, good afternoon, and good evening to everybody who's joining for this brown bag today. We are very happy to have with us some of our colleagues from UN Women. So we have Jessamyn, Encarnacion, Lauren Billi, Rea Jean Tabaco, and Ramya Imandi from UN Women. They will be presenting today on the rapid gender assessments on the impact of COVID-19 on violence against women. UN Women's experience on remote data collection. So a little bit about this talk. So using administrative data from police, violence against women hotlines, and other service providers, UN Women finds that violence against women and girls has intensified since the outbreak of COVID-19. A key concern is that despite the rapid increase in violence against women, the collection of nationally representative population level data has been challenging due to the specific ethical, safety, and methodological concerns that need to be considered during data collection. To understand the extent of this shadow pandemic and to support gender responsive and evidence-based policymaking, UN Women launched rapid gender assessment surveys in 14 countries divided into 2 phases to increase the availability of timely and high-quality data on the impact of COVID-19 on violence against women. The surveys are administered using computer-assisted telephone interviews and implemented under the overarching principle of ensuring the privacy and safety of women respondents. Now allow me to introduce our speakers. We're joined today by members of UN Women's Global Gender Data Program, Women Count. Jessamyn Encarnacion is the Interregional Advisor on Gender Statistics for the program. She is also managing the implementation of the project on rapid gender assessments on assessing the violence against women impact of COVID-19, or what would be referred to as RGAs on VAW during this session. Violence against women. Lauren Billi is the Program and Knowledge Management Specialist leading on knowledge management processes of the program. She is also leading the coordination of the RGAs on the Violence Against Women project. Rea Jean Tabaco is a statistician for the Women Count program, co-leading the technical and substantive matters of the project. Ramya Imandi is a statistics analyst directly supporting the project. So before we start and we hand over to our colleagues, let me mention a few of the usual things. The question and answer session will be at the end. We try to make this talk about 40 minutes. You can use the raise your hand function and we'll give you the floor and you can unmute yourself and say it. And that is the preferred option. There's nothing more mundane than having one person like me read all the questions. So I would hope you would take advantage of this functionality. If you do feel shy or you'd like us to read it, we will read it. So you can also just write your question in the meeting chat during the presentation. And one of the moderators, today Alex is out, so I think I'm the only one, will ask the question for you at the end. So as you can tell, this brown bag is being recorded. So choose what you share and please keep your microphones muted. So at this point, I'll hand over to the UN Women team for their further.
Yeah, thanks, Sean, and also to Alex for organizing this session. Good morning, good afternoon, and good evening to everyone. We thank you for joining us today, and we encourage you to ask questions and provide suggestions, as we would like to take this also as an opportunity to consult with you as we continuously improve the survey tools as well as operations as we kick off the second phase of this initiative next month. So next slide, please. Today, I'm joined by my colleagues from the Women Count program of UN Women, and we will be sharing with you our efforts on making the gendered impact of COVID-19 counted and visible through RGAs, or rapid gender assessments, both on the socioeconomic front as well as on the violence against women front. So we'll focus on the latter for this session, particularly on our learnings on the survey design, as well as field operations during the first phase, quite unique to data collection on violence against women. Next slide, please. Next slide, please. So since April of last year, UN Women has supported RGAs on socioeconomic impacts of COVID-19 in at least 52 countries spread across all regions. And I invite you to visit our Women Count Data Hub, data.unwomen.org, to access the results from these surveys. Next slide, please. Before I continue, we will be asking you questions in between as we would like to make you part of this presentation. You will always have two ways to provide your answer. First, if you can show the Slido kindly, Lauren. Are we able to show the QR code, Lauren? Sorry. Okay. Please bear with us. Yeah. So first, so you will always have two ways to provide your answer. First, from your phone, please scan the QR code flashed on your monitor, upper left-hand side, or go to slido.com and enter the code on the top left part of your screen. So the instruction is shown on the bottom part of the left-hand side of your monitor. So the code is 657794 for those using the website. So first question, game. Out of 52 countries which conducted the RGA supported by UN Women, how many do you think have collected data on violence against women, at least those related to it? I'll give you 5 seconds. 5, 4. We still have only 9 responses. I encourage more responses, please. I see that there's 32 of us who are connected. 5, 4, 3, 2, and 1. So I see that the topmost answer, almost half of you have answered. 22 out of the 52 countries have asked questions on vow related items. And the correct answer, next slide, please. The correct answer is B. Yes, so most of you who have responded have gotten the correct answer. Only 22 countries spread across Africa and the Arab states have asked this question. And this is the case because of, next slide, please. As conventional data collections may not be feasible, we use remote data collection methods, but we must also consider respondent burden, building interviewers' rapport, which becomes more challenging when not done face-to-face. Next, data limitations from RGAs. We must understand what data can and cannot be collected in case some questions may pose serious safety risks to those interviewed, and what data can and cannot tell us. For example, a decrease in support services for women survivors of violence may not imply a decrease in the number of violence incidents, but rather an increase in women's difficulties accessing telephones while being confined in the same space as their perpetrator. And of course, doing no harm principle should be the highest priority, as it may involve interviewing women who are potentially in abusive relationships and precarious situations. Next slide. There are a number of global guidance documents produced within the UN system. Um, however, we are still needing more guidance. Yeah, next, please. Next, please. However, we're still needing more guidance on remote data collection, particularly on data on violence against women, be it in the context of with or without crisis. So if you know of relevant resources from the UN, we welcome this info and please provide it or share it on the chat. After laying down these challenges that I've mentioned, I now give the floor to my colleague, Lauren, who will present UN Women's efforts in addressing these challenges.
Okay, thank you. Sorry, just a technical difficulty. So just an overview of the project that we're currently doing. The project intends to measure the impact of COVID-19 on violence against women while addressing the ethical and methodological challenges inherent in such data collection. The project is framed around 3 outcome areas, one on data production, in which we aim to collect data remotely on the impact of COVID on violence against women through 14 rapid gender assessments. 2, creating an enabling environment through which we'll produce guidance on how to do the remote data collection on violence against women based on our learnings from this experience. And 3, improve access and use of this data that will be collected through producing global and country reports and interactive dashboard on the Women Count Data Hub. These objectives are intrinsically aligned with the Women Count program to which myself and our colleagues currently sit. For this project, we have also conducted a series of internal and external consultations with our partners, including Ipsos, which is our data collection counterpart, administering and developing the questionnaire and doing the fieldwork implementation. We've also held series of consultations with country focal points at the National Statistical Offices and Ministries of Women. And of course, other organizations that are experts on VOW data collection and through our donor as well. We have set up a technical advisory group that is composed of global experts on violence against women statistics, research, and experts from the field. And their objective is really to overall steer and provide advice on various stages of the project. We have likewise consulted with other agencies in their expertise, particularly on ensuring safety and ethical considerations during this survey, including with the World Bank. For this project, as mentioned, we'll be doing the data collection in 14 different countries, and then we'll be taking a two-phased approach. Currently, we are in the first phase collecting data in 4 countries. And the basis of this data, the selection of the countries, there's an indicative set of criteria that have been identified. Our main objective is, of course, is to make sure that we have the support within each country of the National Statistical Office and the women's machineries as well. For phase 2 countries, it's important to note here that the phase 2 countries will really benefit from an optimized questionnaire that will be based on the learnings from the phase 1 countries. Just a quick snapshot of the sampling design. The mode of data collection will be through CATI, which is the computer-assisted telephone interviewing. The sampling strategy is targeting women only, ages 18 plus, around 1,200. And we know here limitation, it's a nationally represented sample, but only limited particularly for women with mobile phones. And also based on our experiences in conducting rapid gender assessments in Ethiopia, we're making sure that there is a gender match between the respondent and interviewer as part of the safety and ethical considerations. For the questionnaire and interview manual that has been developed, we looked at 3 main thematic areas, one on demographics, socioeconomic characteristics, health, and safety. And you'll see the various components in which the data will be collected. And then I'll hand over now to my colleagues, Rea Jean and Ramya, to share with us some of the learnings so far.
Thank you, Lauren. Good morning, everyone. The team learned a lot from this project. I'm telling you, starting from the preparation stage and even planning for the survey design. One of the most important takeaway for us is that women who have experienced violence were affected physically, emotionally, and socially. And since this is conducted through CATI, when the interviewers pick up the phone to randomly select a respondent, they do not know whether the respondent is a survivor or even if she is currently experiencing VOW. Next slide, please. And while the project aims to understand how COVID-19 affected the situation of these women, we learned that implementing data collection process might indirectly add risk to these women in many ways. Next slide. First, for some women, they might not be comfortable in talking about the topic itself to other people, much more to a stranger, and much more to someone who's just talking to them on the phone. We recognize this and we know that confidentiality is of utmost importance. Thus, prior to the start of the interview, informed consent and confidentiality agreement are provided with the following information, which is similar to our usual surveys. But in collecting BOW data, we want the additional measure to assure the respondents that any sensitive information will not be traced back to them and will not harm them in any way. The last thing we want is to put the respondents, some of which can be victims, at a greater distress. And in addition, to make sure that they fully give their consent, questions asking them if they understand the agreement and all the privacy concerns is being repeated. And only when they do not have any questions will the interview start. Next, please. A link to a more detailed privacy information was provided to them, which they can review prior to the start of the interview. And the document is available in both English and their local language. Next, please. One of the general challenges in conducting CATI surveys is the difficulty of building rapport with the respondents, as mentioned by Jessa in her presentation. And she also said that this can be easier done in face-to-face surveys. But in particular, for data collection on violence against women, some respondents might be afraid of being penalized and may not be willing to share personal and direct sensitive experiences. Thus, we mostly use indirect questions. Some questions refer to referring other women they know, and other questions refer to the general situation in the area where they live. Next, please. We also apply different types of questions to capture the extent of violence. These sets of methods were enriched by consultations with other organizations implementing BOW data collection, such as World Bank. Particularly, we use vignettes and list randomization, which will be discussed in more detail in later presentation. Next, please. As mentioned, experience of BOW can have a lasting effect on women. Even if the incident already happened a long time ago, there are words, phrases, and questions that can still make women, particularly survivors, uncomfortable. So, what did we do about it? Next, please. To outweigh this, the words and phrases used in the questionnaire are well crafted to ensure that there are no unintended miscommunication, misrepresentation, or misuse of words. For example, in some instances that can be linked to a woman's direct experience, the mention of violence was replaced by physical harm. We are also advised that the word violence might have mixed interpretation of the term, and instead we can use the specific acts that are described to make it more concrete. Next, please. Interviewers are instructed to read the script provided to them and act neutral at all cases. In encountering survivors affected women, for example, they can be empathic, but some phrases cannot be simply thrown out, such as "poor you," "why don't you leave your abuser," or "I know how you feel, things will get better." Next, please. So those words, the enumerators are specifically asked to refrain from using those sentences. Next, please. And at any part of the interview, respondents can use the skip word to signal that they do not want to continue it anymore. Again, we are building from World Bank's experience from their surveys. We use a more neutral term as a skip word, which is a country-specific popular local food. Next, please. The survey must be conducted in complete privacy. As we know, a perpetrator might be in the same household and we do not want to risk them hearing the conversation, or maybe someone else from the household relaying the information to them. As a measure to counter it, we ensure that interviews will not continue if the respondent is on speakerphone. Next, please. So I've been saying that we want to ensure that woman should be alone during the interview, but all rules, maybe some rules have exceptions to it. So as much as possible, no other person should be present during the interview except for children up to what age. So can you kindly connect the slide again? And if you got the previous question wrong, this is your chance to redeem yourself by checking which is up to what age do you think children are possible to be for the interview to continue. I see some responses, 2, 3. I'll give you 5 more seconds. So 5, 4, 3, 2, 1. I think there's a landslide that up to children of age 2. So next, please, let's check if your answer is correct. So yes, so interview will not continue if someone over the age 2 is present. So why is that? According to WHO, children 2 years old and below do not speak much yet, and their words are not yet clear. But more than 2 years old, children may remember random word or responses already, and they can mimic these words out to family members and worse to the perpetrator. So as much as possible, only 2 years old and below. There is a constant reminder to use up skip word anytime someone else is around. And questions ensuring no one can overhear is repeated in various sections. If they say that they do not have privacy, they are redirected to a neutral question and asked if they are willing to participate again next time, scheduling it at a later time. Next, please. And lastly, the challenge is that respondents may need access to helplines and resources, and we do not know who among them needs it. Thus, lists of helplines are available at the end of the survey for all the respondents. Last year, the eval section of UN Women worked with Facebook to create a list of helplines of survivors in different countries, and these were used in the list at the end of the questionnaire. Next, please. So as a summary of what I presented, I think we can say that yes, there are instances that women's safety can be compromised during the survey, particularly in the use of CATI in these many ways. Next, please. But we did some steps to ensure that this will not happen during the preparation stage. So I will put the spotlight to my colleague Ramya to talk about more about our learnings, this time during the actual data collection stage of the project. Thank you.
Thanks, Rea Jean. So presenting the slides on UN Women's learnings from Phase 1 data collection activities, to just reiterate, our Phase 1 countries were 4, Thailand, Ukraine, Cameroon, and Kenya. So next slide, please. Of course, we face certain challenges during our survey operations and also specific to violence against women data collection. And we've tried to group them into 5 major categories. The first being study design. Can we move forward, please? Next slide, please. Okay. So the first most challenge that we have faced is the difficulty in reaching the quota target for women aged above 60 plus. And this is a common phenomena across all the countries. But luckily, we had another contact database from earlier surveys in Kenya, so we could adjust the sampling frame only for Kenya and solve this particular challenge. The next challenge that we faced was there was a very slow start of interview completion rate in Thailand. This was majorly because there were high dropout rates. So the solution that we provided is adding enumerators, which of course proportionally increase the number of interview rates. And repeated the training program for enumerators, also sensitizing them that to be mentioning that the survey is supported by the government. Basically, most of the women had concerns that how their contact information is available with the enumerators. So this kind of pacified the respondents in participating in the interviews. So this gradually improved the interview completion rate to 40% in week 3. We, of course, understand the need to systematically capture the changes. The survey has already captured questions on the impact of COVID-19 during the COVID, but we also decided to include much more questions for what participants felt before the onset of the COVID. Next slide, please. Thank you. With respect to field scheduling, there was an initial delay in survey operations, mainly because of the bank holidays observed in Ukraine and Thailand. But this was also coupled with high refusal and screening rates, again in Ukraine and Thailand. This definitely reduced the completion rate of the survey by 30% when compared to Kenya and Cameroon. With regards to the preference on whether they wanted working days or non-working days, Kenya and Ukraine preferred working days, Kenyans preferred morning times and Ukrainians preferred evening times. Of course, no preference shown by Thailand and Cameroon. This is just to show that none of the countries performed similarly, and we can be comfortable in saying that one solution might not fit all the countries on same background. Next slide, please. With respect to field scheduling, again, the average interview time was between 23 to 28 minutes. You will notice there is a gradual decrease in interview time week after week. This also can be inferred that enumerators adapted to the survey attitude and method. You'll see a drastic or a sudden drop in Thailand, especially again because of the reason that I've mentioned earlier, that the first 2 weeks were very low response rates, so the sample numbers were too low. And with the week 3, it was significantly low. The interview duration was significantly low. Next slide, please. Okay, just to tickle your intuitive minds, what do you think are the type of questions where we get more dropouts from respondents? Would you think are the options from the options given demographic questions, questions related to health and well-being, questions related to health, related to violence? I can see a lot of participants answering, so I'll wait for more 5 seconds. All right, it touched 10 participants. So yes, we see a lot of responses saying questions related to violence were the questions where the respondents dropped out. Let's see in the further slides, please. Going from top to bottom, which were the questions where respondents chose to drop out? The questions were mostly which district do you live in, which area do you live in, what is your marital status, income, how many people in your household, and what is your education. So you can see most of these are demographic questions where participants chose to drop out. Next, please. And the next set of questions were related to health and mental well-being, where they were unable to control important things in their life, their confidence levels, whether difficulties were piling up. Second question is based on FAO, food security question, where we asked them whether they have enough food to eat, did they skip the meal. So you see again, there were pretty high dropouts here as well. Next, please. So these are the questions mostly which were lengthy. So that could be one of the reasons why participants probably dropped out, because of the lengthy nature of the question. These are the set of questions which pertain to the sensitive nature of the question, directly or indirectly posing on violence. How common do you think the story is? This is again a vignette question where the story is read to the participant. Personally, have they experienced any discrimination? What do they think about violence in their area? Or do they feel unsafe in their homes? And what do they feel about themselves or other women experiencing? We have given certain options such as verbal abuse or sexual, the terms were not sexual harassment, but indirectly meant some kind of physical harm. So you can see the number of times these questions were dropped out were very low. Next, please. Next, please. Yes, and just to highlight here in the previous slide that the first question had higher number of dropouts than the rest of the sensitive questions. This is also because the first question was a lengthy first vignette question, which was also a lengthy question. So it was coupled with 2 reasons. So the overall dropout rate is about 6% in, next please. Yeah, the overall dropout rate in the survey is 6%, which is pretty much consistent with most of the surveys. So these were some of the findings. For now, I will hand over to Jessamyn to take over, please.
Yeah, thank you. Ramya. So, eliciting truthful answers in surveys is challenging, especially when studying sensitive issues such as violence against women. There is a potential bias that results from social desirability. And so, for this project, we especially thank the World Bank on this sharing for their experience, where the list randomization questions as well as vignette questions were used in the study. And on the list randomization, we had control and treatment groups and asked them three the same and supposedly neutral statements, except that in the latter, in the treatment group, we had an additional statement, particularly relating to the direct experience of violence against women. The red statement on your screen is that additional or target statement. We simply ask both groups how many of the statements you regard as true, and presently, what we derive as simply difference in means estimator are the results of this list randomization experiment. Next slide, please. So design effect, next, please. Design effect may arise when respondents evaluate statements relative to one another. In the above example, whether the respondent will report that she has been slapped by her husband or partner may change depending upon whether or not she wanted more child or open a new business or facing economic hardships. So these have been included in the list. We must also consider, sorry, I'm hearing sounds in the background. Can can he or she mute himself? Yeah, thank you. So we must also consider possible presence of ceiling and floor effects. So if the respondent should actually say true to all statements, she may not report a count of 4 truths, as she might be losing her own desired level of protection, that she will already be identified as a victim of physical violence. And that is your ceiling effect. If the respondent should actually say true to only one statement, she may not report a count of 1 truth and instead report 0. Next, please. Uh, and, and instead report 0, as she might not want to run the risk of revealing that her response is actually the targeted statement on violence against women. And that becomes your floor effect. Thus, to make sure that there is no design effect, next please, we need to check whether some people will answer affirmatively or negatively to all statements. We need to calculate the probability of responses accounting for the expected value vis-a-vis the observed values. Next slide, please. So we've also learned that we need to make sure that the statements we use in the list randomization are not correlated. So you see on the middle part of your screen the original statements that we have included in the questionnaire. Next, please. However, when we conducted phase 1 of the survey, the 4 statements targeted at identifying victims of physical violence are seemingly correlated. For example, on the top left-hand side of your screen, the targeted statement on whether she has been slapped by her husband or partner, the abusive behavior may be due to economic hardship, risk-taking, or not wanting more children. Thus, based on technical discussions with World Bank, you will see on the right-hand side of your screen, we revised the statements to what may be deemed as uncorrelated. That is, retaining the targeted statement on violence against women, that red statement there, and having 3 neutral statements on preference on food, local musician, or sports. Next slide, please. Aside from list randomization, we also used vignettes. These questions describe an event, happening, or circumstance, or scenario, and the wording of which is often experimentally controlled. So for example, on your left-hand side of the screen, we gave the story of Mary and John, and both hypothetical characters, where John abuses Mary physically and verbally. We then ask the respondent whether this is common or not in the area where she lives. This then serves as an indirect question as well as proxy to prevalence of violence against women. And results for Kenya showed that there is internal consistency with the response to the vignette vis-a-vis other similar related questions. We get similar results on the vignette on physical and verbal abuse, with the responses on a separate question on whether she or any other woman they know have been slapped, kicked, or yelled at or called names. Next slide, please. Now, in terms of respondents' reactions to ethical and safety protocol, there were mixed reactions in terms of willingness to participate. Some were embarrassed, some were told more about their experience. Some are a bit hesitant at first, but became more open as the interview progresses. And we have like interview manuals to make sure that the interviewers are able to manage these different situations. On the use of sensitive words, most of the response, such as harassment and discrimination, most of the respondents were not troubled with the use of these words. In some cases, the interviewer had to provide the meaning and explain further, and the issue is often resolved. However, we experience in one country an aversion to the term or reference to COVID-19 in some of its respondents. And at the end of the interview, we provided details of helplines to all respondents, as mentioned by Rea Jean earlier, whether or not they know somebody who have experienced violence against women. So it's provided to all. And particularly in Ukraine, for example, more than half asked for more details of support organization. Next slide, please. So in summary, we've certainly faced challenges in survey operations very unique to violence against women data collection, and particularly for remote data collection. Some of which we have already applied in phase 1, others to be applied in phase 2 starting next month. In summary, next slide, please. In terms of study design, we have adjusted the sampling frame, had rigorous training, improved the questionnaire. In terms of scheduling the fields, we are now more cognizant of bank or public holidays. Reflections from the field in terms of shortening lengthy questions, how we have learned a lot in terms of using indirect questions, particularly use of vignettes and list randomizations, and how to check for design effects and correlated question statements. And last and most important of which, the ethical and safety considerations. That we need continuous training of enumerators to be sensitive to the reactions of respondents as well as to words being used. Lastly, we've had, so bottom line and in summary, we've had extensive consultations both internally and externally. We've had issues and challenges, not surprisingly so, and we've responded to them, be it during the planning stage or conduct of the surveys. And lastly, we've adopted the survey tools and operations to optimize this in time for phase 2 implementation. Next slide, please. So next steps, next please. We now have phase 1 results covering 4 countries. That's on your left-hand side of the screen. This is informing the Generation Equality Forum happening at the end of this month. And in parallel, we're now also in the optimization stage, your yellow box there, to inform the conduct of phase 2 to have results ready by UNGA and by the 16 days of activism come November. And updating, as mentioned earlier, there have been a guidance on remote data collection, at least from UN Women and WHO during COVID-19, released last year, and we intend to update that based on these learnings that you have heard so far, and will be released sometime by the end of this year. That being said, thank you to everyone for the time and to my colleagues for the presentation. Over to you, Sean.
Thank you, Jessa. Can you hear me?
Loud and clear.
Okay, yeah. No, I appreciate the presentation and the content in particular was very relevant in this time of COVID. I wanted to reach out to some of our members of the audience to see if there are any questions. So I had one question that I was thinking of. I mean, I was interested in the challenge of asking sensitive questions, and I think this is something that your presentation highlights more than out of any other that I've seen. I don't know if you recall, but last week we had a presentation on access to confidential information and some of the cryptographic methods that make it possible to do statistical analysis of data that you can't see, as a means of, sort of promising to participants that the individual responses will be encrypted and not available to analysts, but the aggregate information through, some of these differential privacy techniques or multi-party secure multi-party computation, the analysis of the data can be done without revealing individual responses. And I thought the promise of this technology was that it potentially allowed researchers to give a strong confidentiality guarantee for data like this. And I just wanted to ask if you've heard of this or considered this technology in this particular domain, because it seems to have a strong match. And if it sounds like I'm talking jargon, then you can just ignore my question. But
Yeah, thanks, Sean. I think very valid point, especially on data confidentiality, data protection. And just to say that it's also one of the things or challenges, if I may say, in terms of what we would like to address moving forward in terms of dissemination policy with the outputs coming out of this project. So we have, as Lauren mentioned, we have a technical advisory group. Very early on, we are receiving advice, particularly from UNFPA, as to how do we go about release of microdata coming from the surveys? In the first place, do we actually release microdata? And if we are to release, I think that's where your point is coming from, Sean. What are the data privacy techniques that we should be employing? And this is something at the moment we don't have the technology to do so, and we would welcome like more learnings from either from UNSD or other partners here in the chat, or pointing us to other institutions who can provide wisdom and advice with regards to this. But definitely, unless otherwise we have great confidence that data is fully anonymized, we will not release the microdata.
Thank you very much.
Yeah.
Do we have any other questions? Anyone else? I see Hao-Yi has a question. Hao-Yi, would you like to open your mic and ask the question?
Yes, thank you so much, Jessa and colleagues. I know you've been doing this. I had no idea what's behind all this effort, and this is fantastic. Given that a lot of people had in their mind doubt about collecting violence against women through telephone interviews. So my question is, are these experiences documented? Your presentation, can we actually help sharing with other stakeholders so they can learn from your experience gathered through this exercise?
Yeah, quick response to that. Yes, it's being documented, all these experiences. In fact, in the point made by Lauren during his presentation, this project has been designed not only to produce new data, but also to provide guidance on how to collect data as sensitive as violence against women in a setting where you can only do it remotely. So we are like coming up with a global guidance or guidance document based on this empirical, based on field experience from these 14 countries. And just to also add that this guidance will not only be informed by these 14 countries, but likewise additional resources that our partners like World Bank has been providing. They've done like similar or related surveys on violence against women, particularly in Southeast Asia. They've openly shared with us these resources, and we would also like to include these learnings. Likewise, with some members of the technical advisory group, they have also spontaneously shared these resources, and this definitely would be informing that guidance, documenting these learnings. And as in the interim, while we have yet to reach that point in December in terms of availability of that guidance document, the PowerPoints that we have been sharing or using, please feel free to share that with others. I honestly think that the key messages there in terms of how to handle sensitive topics somehow already provides some key learnings or key findings that might be already useful to other agencies.
Thank you, Jessa.
Sure, thanks, Howie.
Thanks a lot. So I just wanted to move on. There are a couple more questions, I think. So Mehmet had his hand up. Mehmet Sokoli, would you like to unmute yourself?
Sure. Thank you, Jessa and UN Women colleagues for your efforts and insightful presentations, and congratulations on this impressive undertaking. I was wondering if you could tell maybe more about your experience with building rapport with the respondents, potential victims, while collecting data remotely via CATI. Perhaps namely on how the interviewers could receive and recognize emotional stress of the respondents during the interview and how they could minimize it. And I was also wondering if there were any NSOs that were directly involved in these rapid gender assessments. I learned from your presentation that Ghana was in the technical board already. And I'm also looking forward to the forum and your optimized results. Again, thank you very much.
So, Sean, so just on the 2 points on the engagement with the NSO, probably I'll give the floor to Lauren, who led the coordination with this with our national partners, and Rea Jean with regards to the rapport between the interviewee and the interviewer. So maybe Lauren, you might want to address that.
Sure. Thanks, Jessa. As we mentioned in our presentation, definitely coordination with the national statistical offices, particularly when selecting the countries to be part of the study, has been critical. In particular, we set the standard in which that if we, when deciding countries to engage, we need to make sure that we closely coordinate with the national statistical offices and receive their tacit approval for the methodology and the collection of data for this project. And that has been pivotal to ensure greater buy-in with the national stakeholders, and ultimately we hope this would greater facilitate uptake and use once the data is produced. So we've been regularly informing our national counterparts of the progress of the project as much as possible and coordinating accordingly. So I hope that answers your question.
Hi, Mehmet. In terms of building rapport with the respondents, it's really one of our challenges with just the telephone call. So part of the training that we provided to the interviewers is actually addressing that mainly by providing actual scripts that they can use and reminding them all the time that they have to be neutral. And I think part of the building rapport with the interviewers is providing a very not really, I don't want to say long, but like a series of informed consents in the beginning, like assuring them that all information that they give is confidential and all those things.
Thank you very much. I hope that answers your question, Mehmet. So in the chat, there's been quite a lot of discussion. I think Mr. Papa Sek from UN Women had a suggestion to consider sharing some of these experiences through the ISWGHS. I'm actually not aware of that acronym, but I'm sure Jessica can help me out. So if anybody would like to raise their questions from the chat into the public domain, that would be nice. I see Mariana Neves has a question. Another question, if you have protocols for addressing enumerator sensitivities. Would anyone like to answer Mariana's question on addressing enumerators sensitivities? Perhaps you'd like to.
For enumerator sensitivities, maybe, and I invite Rea Jean also to jump into this. actually in this as we have engaged Ipsos in this survey data collection, we are also wanting to get like sort of reflections as well as reactions from interviewers on how, and we specifically wanted, if possible, to identify interviewers who have done like face-to-face collection of violence against women, and likewise CATI approach to violence against women. And then from that kind of learning, we will be able to see how they are able to adapt the kind of learnings that has been done through the field operations using different approaches. So this will also inform us, hopefully in the optimization stage, and likewise in further increasing sensitivities aside from the useful trainings that we have done for this particular survey. So I think that is something that was also a learning point in terms of probably we'll have that kind of cognitive testing with regards to interviewer approach. So Rea Jean, in case I missed anything with regards to that.
No, Jessa, that's a very comprehensive take on that question. Thank you.
Excellent. Thanks a lot. So we have a good chat going on now. Are there any more questions for our speakers today? Just going to quickly make sure I'm not missing any hands. I'll give it a few minutes to see if there's anyone who'd like to come forward. Otherwise, we'll slowly draw to a close. I have to say, I was really impressed with the use of Slido. I mean, I've known about Slido, but just seeing that ability to quickly get people's, an understanding of where people stand as you're giving a presentation is telling. You can see, we all thought it was the violence questions in that particular, that would give maybe the most subject to dropout. In fact, it was demographic, and that was one of my questions is that something that varies from country to country? That seems like a very interesting phenomenon that I don't quite understand. Is that something you see universally, or is it something that's particular context where people aren't comfortable answering demographic questions? Because those would be the first things I'd volunteer just without even thinking about it. But I guess that varies depending on your background.
Yeah, at least for the 4 countries that we've had in the phase 1, it was systematically observed across all 4 countries that dropouts have been highest towards the demographic questions, particularly on area where they live, probably possibility of traceability and income. And then next towards that is more on the lengthy questions on food security as well as on mental health. Yeah.
Okay, and when you say dropout, that means they at that point they dropped out of the survey.
Yeah, they drop out the survey.
Interesting.
They simply just drop out, or they simply tell you to stop the interview.
Yeah. So Mariana Neves asks, I'm guessing in the context of a discussion, do you have gender identity? Mariana, is that right?
Yeah. Well, in the planning stage, we have actually wanted to include that, definitely, especially from UN Women. We have initially wanted that in that first draft of the questionnaire. However, there are so many constraints, time constraints. We can only have one, and then also the more important one is you already have competing sensitive questions in terms of violence against women and gender identity. If you immediately ask questions on gender identity, you run the risk of respondents immediately not warming up to the question. So at that point, we have actually decided initially to include it, but at the end, prioritizing the intent or the objective of this survey, we have had to, unfortunately or reluctantly, had to let go of that question.
Very interesting. So I think we're getting close to 12 o'clock, and I think we've had a great discussion. And so I'll give a few more minutes while I babble on for a few seconds to say thank you. If you have any more questions, please ask them now. Otherwise, it's been a really fantastic conversation with Jessa and your team. I think we're lucky that we have people that are taking this burden on themselves during the pandemic to try to understand how things have changed. I think this is something that makes a difference in many people's lives. And I think we take that for granted as we're discussing these technical aspects of it. So thank you so much for your work and for how you've taken this up. At this point, I don't see any other questions, so I'm going to stop the recording, and we can end the call.